Let's continue our journey of understanding. Your back has been trying to communicate with you, and pain is its language. But like any language, it's one we can learn to interpret more clearly. Here's something that might shift how you think about your pain. The intensity of pain you feel doesn't actually correlate directly with the amount of tissue damage in your back. This is one of the most important discoveries in pain science over the past few decades. You can have significant pain with very little structural change, or conversely, imaging studies often show disc bulges or other changes in people who have no pain at all. In fact, research has found that if you scan the backs of 100 people without any pain, more than half of them will show disc bulges, degeneration, or other abnormalities, yet they go about their lives completely pain-free. Your pain is real, absolutely real, but it's not a simple measurement of damage. It's more like an alarm system, and sometimes alarm systems can become oversensitive. Think about what happens in your body during a typical day before your back pain began. Perhaps you sat for hours at a desk, your hip flexors gradually shortening, your core muscles hardly engaging at all. When muscles aren't used regularly, they become deconditioned surprisingly quickly. Studies show that significant muscle weakness can develop in as little as 2 weeks of reduced activity. These hip flexors, particularly the psoas muscle that connects your spine to your legs, can become tight from prolonged sitting and actually create a pulling force on your lumbar vertebrae, changing the natural curve of your lower back and creating strain. Now, here's where physical therapy becomes like detective work. A skilled physical therapist doesn't just look at your back, they observe how you move, how you stand, how you sit, how you breathe. They're looking for patterns, compensation strategies, and movement habits that might be contributing to your pain. Perhaps you favor one leg when standing, or maybe you hold tension in your shoulders that travels down through your entire spine. Maybe you've stopped bending at your hips and instead curve through your lower back during daily activities. These movement patterns, repeated thousands of times, create the conditions where pain can flourish. One of the first things physical therapy addresses is what we call motor control. Essentially, retraining your brain and body to move in ways that support your spine rather than stress it. There's a beautiful feedback loop here. When you move better, you feel less pain, and when you feel less pain, you're able to move more freely, which further reduces pain. This positive cycle is the foundation of recovery, and it starts with surprisingly simple movements, often just learning to engage your deep core muscles while breathing normally, or practicing a proper hip hinge movement where your hips do the bending instead of your lower back. Here's something wonderful about the human body. It responds to progressive adaptation. This principle, fundamental to physical therapy, means that your tissues, muscles, tendons, ligaments, even your bones, actually become stronger when they're exposed to gradually increasing loads. The key word here is gradually. Your physical therapist will guide you through exercises that start well within your comfort zone and slowly, methodically progress. This isn't about pushing through pain or no pain, no gain. That old philosophy has been thoroughly debunked. Instead, it's about finding your edge, that place where you're challenging your body just enough to promote adaptation without triggering your protective pain response. The core muscles deserve special attention in our story. When we talk about the core, we're not just talking about the six-pack abs you see in magazines. Those are actually the most superficial layer. The real core stabilizers are deeper. The transverse abdominis, which wraps around your midsection like a corset. The multifidus, small muscles that connect each vertebra. Your pelvic floor muscles. And your diaphragm. Together, these muscles create what's called intra-abdominal pressure, essentially creating a stable cylinder of support for your spine. Research shows that people with chronic low back pain often have delayed activation of these deep core muscles. Their bodies have forgotten how to turn them on automatically before movement occurs. But here's a gentle truth. Rebuilding this core stability doesn't require hours in a gym or grueling exercise sessions. In fact, some of the most effective core exercises look almost invisible from the outside. You might be lying on your back, simply learning to draw your lower abdominal muscles inward while maintaining normal breathing, a subtle movement that's teaching your nervous system new patterns. Or you might be on your hands and knees, lifting just one arm or one leg while keeping your spine completely still, training your body to stabilize against rotation and asymmetrical forces. Let's talk about something else that influences your back pain in ways you might not expect: sleep itself. The relationship between sleep and pain is bidirectional. Pain disrupts sleep, certainly, but poor sleep also increases pain sensitivity. When you don't sleep well, your body produces more inflammatory chemicals, your nervous system becomes more reactive, and your pain threshold lowers. Physical therapy often includes sleep hygiene education because improving sleep quality is actually a form of pain management. The position you sleep in matters too. Sleeping on your stomach, for instance, creates a sustained arch in your lower back that can aggravate pain, while sleeping on your side with a pillow between your knees helps maintain neutral spine alignment. Here's something that bridges the physical and emotional aspects of your healing journey. Exercise, including the gentle movements prescribed in physical therapy, actually changes your brain chemistry. Physical activity increases endorphins, your body's natural pain relievers, but it also boosts serotonin and dopamine, neurotransmitters that regulate mood and pain perception. This is why people who engage in regular, appropriate exercise for their back pain often report not just less pain, but also improved mood, better sleep, and greater sense of control over their condition. Movement is medicine, but it's medicine that treats the whole person, not just the painful area. And so, as you rest here tonight, consider this. Every breath you take is an opportunity for gentle core engagement. Every comfortable position you find is your body's wisdom guiding you toward what it needs. Your healing has already begun simply by seeking to understand.